what you're seeing is that sort of what's different now that's leading to these higher diagnoses, these greater problems. It's partly about more environmental stress, but not just that, because there's been environmental stress for decades, as evidenced by your childhood. But it's sort of that with the combination of the lack of community help, the, sort of the village that's helping both the parents and the child together. So less of the tribal village, more stress. Is there anything I'm missing about sort of what's different now that's increasing this?
Well, yeah. So let me just sort of elucidate that a bit. So, yeah, people have always been stressed, um, and the loss of this hunter-gatherer structure has been going on for 15,000 years. It's ever since civilization. So the problem began really with agriculture, and then the possession of wealth, and then class society, and wars, and so on. But it's accelerating at a high rate these days. And what is furthermore accelerating is the compartmentalization, so that people are more and more alone. Epidemic of loneliness even before COVID. So that there's more stress, and even in North America, at least, even in the 60s, 70s, one breadwinner could make do for the whole family. That's no longer the case. So you have more stress, and women especially. Women have always had the stress of caregiving, not just to their spouses, not just to their children, but also to their spouses and their environment. But now they have to contribute to making a living as well. And they're doing all that in the context of less social contact and less support. So that's what's going on. And in the last 4 decades of what's called neoliberal economics, where families are more stressed, more insecure. I mean, there was an article yesterday that a large percentage of Canadians are $200 away from being in debt, and they're anxious about it. So I mean, even in this wealthy society, people are anxious, they're isolated, and so on. So it's a combination of all that. Now, and one more thing. Now, many of you probably watched as I stood up from my chair here and I went to the back of my room, picked up a book off my shelf. At any time I was doing that, raise your hand if you were worried that I would float off to the ceiling and fly away. Anybody worried about that? Okay, well, how come you weren't worried about that? Why were you so confident that I would stay on the ground and walk back to you? What made you so sure? Very simple question. Angela, you're on. What made you so sure that I would?
Well, Navi says, well, we could see you.
No, but how did you know that I wasn't going to start floating?
Gravity.
Exactly. Go to the head of the class. Now, what is gravity? It's a force of attachment. It pulls two bodies together. Okay? It pulls me to the earth. And I exert a little bit of a gravitational force that also pulls the earth towards me, a little bit. All right. On the other hand, if I landed on the moon, if I was beamed up to the moon, from Star Trek, Scotty beamed me up to the moon, and if all of a sudden I landed on the moon, now would you be worried that I might fly off, that I might float off?
Yeah.
Why would you be worried about that?
No gravity.
Yeah, well, there's gravity, but it's much less.
Okay.
So the gravitational force of the moon is not enough to keep me grounded. So if I'm going to walk on the moon, I have to wear heavy boots. Yeah. Now, that's not a problem because we understand about gravitation. So when cosmonauts or astronauts or whoever nauts go to the moon, they wear heavy equipment because they're compensating for what has been lost. Our society has lost the gravitational force of attachment, but we're not aware of it, so we're not compensating for it. So the problem is not simply that we're not hunter-gatherers. We can't be hunter-gatherers. It's a good thing because my family would starve, you know. But if I was a hunter-gatherer, um, that's not the problem. The problem is we've lost what those people intuitively knew. And now we're having to research all these things all over again. And so mothers, fathers, teachers, physicians are not taught about attachment and how to make attachment happen. That's what the problem is. And that's what this talk is all about.